what I want to do is give you the answer to which of these hops are you most happy with. Are you happy for your patient to progress? What would you do in these situations? So I'm going to give you 2 more opportunities to watch this. So again, look at what's happening at the foot, look at what's happening at the knee, look at what's happening at the torso. So again, if we go rep 1, okay, are you happy with that? Rep 2, you can see a bit of a valgus, are we happy with that? Rep 3, are you happy with that? Okay, now my answer to that is I'm not happy with any of those repetitions, and here's why. Okay, so what I'm looking for here is when that foot hits the floor, what does the knee do? Okay, does the knee keep traveling, or can that knee co-contract and ultimately brace? Okay, so if you look at what happens as the foot hits the floor, we can see that that foot hits the floor and the knee is going to still continue to travel. Okay, so we get that eccentric loading through the quad. Now in the second rep, the foot hits the floor, we get that bit of valgus. Okay, now what's the problem here? Is this a weak glute, or is it just a lack of intent through the midfoot? Okay, so what are we seeing here? Once again, foot hits the floor. Okay, and we can see again, I like that perturbation. I like the way that little bit of a wobble there. So again, that's the nervous system figuring things out. There's a bit of a perturbation. There's going to be a lot of preflexes, reflexes happening there. But again, the key thing, this is probably the best out of all of them, but it's still not great. So what we want is we don't want that eccentric load ideally happening. Now, if I got him to jump off a box, and he would need an eccentric loading. But if we're just running, okay, or if we're our athlete's running, we don't want the athlete to be sinking. Okay, so as that foot hits the floor, okay, if I just get this a little bit better for you, a bit of a sharper angle, okay, as that foot hits the floor and the knee, ultimately what we want to happen is we want that knee to co-contract. Now there's a few things that has to happen. The intent has to happen, okay, through the midfoot, but specifically soleus is going to be very, very important there. Okay, so as that foot hits the floor, we need good intent through soleus. Okay, because soleus and hamstring are going to work well together here to stop that translation of the tibia going forward. Okay, or said another way, the knee to flex. Okay, so in the second rep, I have poor intent through my midfoot. You can see the reaction happening. Okay, I want you to do this yourself. Okay, so sit in a chair, and all I want you to do is I want you to basically let your knee go in and out. Okay, then I want you to squash an orange through your midfoot and let your knee go in and out. Now notice the difference in your hamstring activity. Okay, and notice the range of motion that your knee can go through now. Also, when you squash an orange through the midfoot, notice the tension that builds up in your hip. Okay, so that soleus needs to fire. Okay, we need good intent through soleus. Then what that's going to allow the hamstring to do is be in a better length tension relationship. Okay, so when we don't sink, what happens then is the hamstring's in a much better length tension relationship. If we sink and that knee goes too far forward, then we're going to get a massive eccentric loading through the quads. Okay, maybe not a massive, but we will get some more eccentric loading. Remember, what we want is we want elastic energy. So we want, when that foot hits the floor, I'm not talking about terminal swing, I'm talking about when that foot hits the floor, we want all of these tissues to work almost like isometric-like conditions so that we can utilize elastic energy. Now, if we can co-contract at the knee joint, and we can stop that knee coming backwards, or said another way, delay knee extension, that allows then the hip to do work. Okay, so this soleus, this is the wife. Okay, this is the kids. Okay, this is my analogy that I use, and this glute is the husband. Okay, and we all know who the real boss is in the house. Okay, it ultimately is the wife and the kids, because if the soleus doesn't do its job, what's going to happen is this bum is going to drop, this knee is going to flex forward, and then what goes down must come up. So we're going to end up with a lot of vertical force rather than horizontal force. So the job of that hamstring and gastro here, okay, and your proximal gastro, is the delay knee extension. Okay, so what we need as your foot hits the floor is we want soleus and hamstring, okay, to work well together. But there's no point worrying about hamstring if the soleus isn't doing its job. Because as your foot hits the floor, if soleus isn't taking the load here, we're ultimately going to let that knee continue to go forward. The bum's going to come down, and hamstring now is in a shortened position. So the length-tension relationship of that hamstring is going to be altered. Okay, so the soleus is key to get the hamstring to do its job, and then as we propel forward, the hamstring and the gastro are very, very important to delay knee extension to allow that glute to go there. Because if this knee just snaps back, then you've achieved hip extension, but it's fake hip extension. Okay, because the knee is just snapped back, so then the hip hasn't gone forward, it's just literally being passively extended. Whereas if we delay knee extension, okay, then what can happen is we can get something like this, okay, where the hip's gone through and then the knee extends. Okay, so it's very, very important that that knee doesn't snap back as we're pushing off. So the hamstring and gastro are important to help the glute, but the glute is dependent ultimately on the hamstring, as I just said, but the hamstring is depending on the soleus. Okay, so if we go back and we look at this video, what we want to see is we want to see as that foot hits the floor. Okay, if I can get good intent through the midfoot here, that's going to ultimately get my medial hamstring and the sagittal plane to do a little bit more work. So as I come in here, I can manage that. Okay, now if I've got good intent through soleus, that's going to help me stop sinking. Then that's going to allow my hamstring to be in a better length-tension relationship. So then when I push off again, ultimately I can delay knee extension and allow my hip to work. So the soleus is the wife, the hamstring is the kids, the glute is the husband. The real boss here is soleus and hamstring. But hamstring relies on soleus. Ultimately, soleus relies on intent. We want no perceived threat from the nervous system. Okay, so if you want to know more, this is what's going to happen in Return to Play 2.0. I'm going to be showing you brand new exercises. I'm going to be showing you brand new footage from my professional athletes from the World Cup, using some movements in their warm-ups. I'm going to show you some doing good stuff, some do not good stuff. But I'm also going to be revealing, I'm going to go through this system, but I'm also going to be revealing the exercises that I'm most using commonly for telehealth. Okay, so again, when you can't put your hands on athletes, I've learned a lot over the last 8 weeks with telehealth, and this is what I'm going to be going through. Okay, so you're going to learn basically how to get complete clarity in designing the treatment plan. Okay, I'm going to give you the confidence to communicate this effectively to your athletes, but also that they understand and you understand, know how and when to be aggressive, but also when to be regressive, okay, or regress your athletes. You're going to give the powerful treatment plans because you're going to be designing treatment plans that ultimately is focused on real world movement. We're not going to be giving open chain clamshells and all this stuff, because that's great, but how does that carry over when that foot hits the floor and subconsciously all of this stuff is taking place, that we consciously can't control where the knee goes, but what we can control is intent. And I'm going to show you how to use your cues for that as well. Okay, so click on that link. These are all the teams that I've applied this with. Click on that link and I'll see you for Return to Play 2.0.